Welcome, everyone, to the Michigan Poverty Task Force webinar on emergency preparedness in low-income communities. My name is Olivia Vaden. I'm an analyst in the Office of Prosperity, where the Michigan Poverty Task Force is held. Often, households are caught off guard when disasters strike. With the extra stress low-income households face each day, we can assume that disaster preparedness among these households is likely low, if not non-existent. Michiganders living below the ALICE threshold often lack adequate resources to prepare for and recover from disasters, such as funds to board up their house, a car to evacuate if needed, or a place to stay if they have to leave their home entirely. We also know that the impacts of disasters are felt disproportionately across the state, leaving low income families struggling to rebuild their homes and communities after a disaster strikes. Within LEO, the Michigan Community Service Commission is the lead agency in times of disaster to support volunteers and donations management. The MCSE has a variety of resources and trainings that a team member will provide for you in the chat for your reference. They also currently have a grant application open to support counties and regions with utilizing consultant services to develop preparedness plans in their communities. To speak more in depth about emergency preparedness, we are joined by a representative from the Michigan Department of Health and Human Services Emergency Preparedness and Response Team, Jason Smith. Jason is a dedicated public health and emergency management professional with over 18 years of experience, 13 of which have been with MDHHS. Jason currently serves as Emergency Management Coordinator for the Department of Health and Human Services. He coordinates inter and intra-agency plans, training initiatives, and program development. During emergencies, Jason serves as MDHHS's representative at the State Emergency Operations Center. Jason, I'll turn it over to you.
Thank you, Olivia, and thank you everybody else for joining. Just give me one moment as I get my screen situated for this presentation. I'm going to go off camera. Olivia, is my screen coming through okay?
Yep, looks great.
Excellent. Okay. Well, so just really thank you for having me. I think it's certainly a pleasure to actually be able to kind of get out and present. Really excited to hear what Donna has to say. So I'm going to try to keep it somewhat brief and give her a little extra time to kind of present as we go. But for starters, I think the introduction was very, very fitting. So my name is Jason Smith. I think we have a couple objectives I'd like to go through right off the bat. So what I'm hoping that maybe in this short presentation, we can just kind of identify a handful of things, including recognizing the role of local public health, state public health, and healthcare system support disaster preparedness and response activities within your communities. Explain how disasters are disproportionately impact ALICE populations, and then identify some practical preparedness strategies tailored to meet the needs of low-income or disadvantaged communities. So I think your introduction, Olivia, really kind of teed this up nicely. But I want to begin with kind of a brief overview of some of the high-level phases of emergency management, at least in my field, and kind of how we go through this continuous process improvement strategy. So in the upper left-hand corner, we have prevention. Which, in my opinion, is really the actions taken before an emergency situation or disaster intended to lower the chance of it occurring or reducing its impacts. You know, an example, probably within your community, making buildings safer, paying attention to hazards, threats within the community, or even sharing information quickly between partners. Mitigation, applying lessons learned from emergency outcomes to improve and potentially lessen the damage from future disasters. So you might hear a lot about with the recent flooding or all the flooding, particularly in like Southeast Michigan and elsewhere within the state, some mitigation strategies to kind of improve the infrastructure. Another action would be maybe advocating for safer housing or services that reduce financial and health risks for ALICE populations. Obviously, the crux of where we're here today is to discuss preparedness. I kind of look at it as building capacity, but basically readiness through plans, drills, and relationships, so organizations know who to call and how to keep operations running during times of crises. So basically writing basic emergency plans, running practice drills, building contingency rosters, and including strategies to ensure clients' families have basic needs. Um, the part we really don't like to get into, but obviously, but response. So actions taken during a disaster to keep people safe and meet urgent needs within the community. So an example, opening, helping at shelters, volunteering at shelters, providing food and water to families, and overall being a trusted source of information, and potentially, checking in on populations during this time of need. And then last but not least, this transition over to recovery, which could be days, weeks, or months after a crisis. Basically, an attempt to return to normal through helping individuals, organizations, and communities bounce back and return to normal after an emergency situation. So, I think some of you that have been impacted with maybe Southeast Michigan flooding or tornado impacts throughout the years, it's difficult to navigate some of the assistance programs that either state or federal government launch. So, replacing lost. And then providing assistance with replacing lost or damaged documents, support for reestablishing housing, employment, and even mental health support. A little bit about kind of what I do at MDHHS, just kind of in a nutshell. Really wanted to focus. We really kind of focus on emergency support functions. So where I'm at, MDHHS was a relatively large agency. So we're kind of divided between the community health and the human services side of the fence. I want to speak solely on the public health and medical services side, which is my specialty. Really focusing on kind of what we do during times of crisis. So health and medical response coordination. So we direct and integrate state level health and medical assets during disasters, ensuring alignment with local, state, and federal partners. Public communication, we issue timely, accurate, and culturally appropriate public health information and risk communication. Surveillance and medical countermeasure management. So conduct epidemiology, public health surveillance while overseeing the effective distribution and dispensing of medical countermeasures, whether it be vaccines or therapeutics, healthcare system continuity and surge. The healthcare community is relatively fragile in some areas of the state. So supporting hospitals, clinics, EMS, and healthcare coalitions in maintaining continuity of operations and expanding to address surge capacity should there be an increase in demand. And then lastly, this is kind of a bucketed item here, but behavioral health, responder safety, fatality management, and even mass care integration. So really, providing behavioral health support through community partners, ensuring responder safety and health monitoring for those responding in the field, and delivering medical support within shelters and mass care environments. We also coordinate fatality management operations with medical examiners and mortuary service providers. Now, why does preparedness matter? Especially at the community level and for Alice households. So we look at cascading instability, even isolated events, power outage, flooding, an isolated illness can trigger disproportionate disruption across the employment, housing, and healthcare for Alice households. Exacerbation of chronic conditions. So pre-existing health vulnerabilities heighten the impact of service interruptions and resource scarcity during emergencies. Uh, absence, sorry, of robust safety nets, limited financial reserves, insurance coverage, social supports constrain the ability of households to recover without external assistance. There may be a digital divide or a lack of reliable internet devices or digital literacy. This creates major barriers to receiving emergency alerts, applying for aid online, accessing telehealth, and using remote learning platforms during crises. And then lastly, transportation fragility. Could be limited or no access to reliable transportation, making it harder to evacuate, reach shelters, attend medical appointments, or even pick up just basic supplies. During disasters, this barrier can really isolate these communities even further. Now, kind of wanted to frame the remainder of this presentation from a pre-disaster, during disaster, and a post-disaster lens, identifying some key barriers as well as opportunities for certain organizations and community groups to kind of see if they can socialize and work with this. So identifying some of those key barriers with risk awareness. So you know, many households and even community groups underestimate the hazards within their communities, might reduce the motivation to prepare or potentially reducing the motivation to prepare. Preparedness materials are not consistently accessible across language, literacy, and income levels. And then obviously credibility deficit. I mean, past inequities and inconsistent messaging weaken trust in preparedness guidance and materials that are disseminated within the community. Some key opportunities, and I'm keeping these high level. Simplify, translate preparedness materials tied to local risks. Understanding what within your community is probably going to be the most damaging or impactful. Uh, Trusted intermediaries, so service providers, faith leaders, community organization, use them as conduits for preparedness information. And then institutional integration, working really hard with these groups to embed preparedness education into daily services, almost that constant reminder we should look at September as preparedness month and take the remaining 11 months off. So they could be through schools, clinics, food pantries, etc. Next on my list, pre-disaster alerts and warnings. Some of the key barriers, look at inconsistent access to smartphones, weather radios, internet limitations to receive alerts through iPause, which is a FEMA platform. It's basically a web-based emergency alerting system. Uh, there could be past false alarms or irrelevant messages that could reduce responsiveness to basically high-level official warnings. And then, you know, institutional distrust. Maybe certain families or households just don't know how to enable or manage alerting settings. Some key opportunities, really encourage the use of wireless alerting platforms, um, NOAA or NOAA weather radios, potentially local channels that I have a hyperlink that I hope Olivia will send out a little bit later that shows I'm sorry, alerting platforms within certain communities that are free to sign up for. Practical and equitable education, so providing demos, multilingual guides, and maybe even step-by-step instructions on signing up for these alerts. And then, trusted advocacy, so organizations promote enrollment and compliance, reinforcing alerts through, you being that trusted messenger. Next slide. Here we are. So pre-disaster, again, essential supplies or go kits and financial preparedness. Obviously, some of the key barriers we're looking at: limited income prevents households from purchasing or stockpiling supplies. Daily financial and caregiving pressures push preparedness obviously a little bit lower on the priority list. And then critical records, so documentation vulnerabilities. So critical records, whether it's identification, housing information, medical information, are easily lost or inaccessible during household emergencies or large scale emergencies. So some key opportunities: maybe promote phased, low-cost approaches to preparedness supplies, some of which are hyperlinked at the end of this slide deck. Emphasize critical household, medical, and hazard-tailored items for emergency go kits. And then, use certain resources that are already developed. So FEMA has a really wonderful guidance document. It's an emergency financial first aid kit. Partner with legal aid and financial institutions for support. So to promote this and really trying to kind of set up a network for financial preparedness. Pre-disaster, again, really staying informed. So some of the key barriers: information deserts, power loss, or network failure cuts families off from updates. Official or language and literacy gaps, so official messages may be inaccessible due to language or complexity. Misinformation, so absence of timely official updates. In the absence of timely official updates, I think we all know misinformation spreads through social and peer networks rather quickly. Key opportunities, so trusted messaging, community groups, faith-based leaders, and service providers use them as relay points. Volunteers and staff trained to share consistent plain language updates. And then lastly, organizations that relay community concerns and rumors, try to relay that back to some of the government agencies that you work with, particularly emergency management, particularly your health departments. Kind of keep consistent and sharing that information kind of up and over, I guess. During a disaster, really focus on life safety. Some of the key barriers, obviously, unsafe heating and cooking practice, using resorting to grills, ovens, makeshift heaters indoors, obviously runs the risk of creates the risk of carbon monoxide poisoning, fires, excess burns. Clear guidance or tools like you know meat thermometers, temperature thermometers. Families may eat spoiled food to avoid waste, which would increase foodborne illness. I'm sorry, foodborne illness risk. And then limited transportation, lack of child or disability friendly accommodations, and mistrust of public systems keep families from using warming, cooling centers. A couple opportunities here. Integrate plain language, safety tips into daily interactions and outreach. This could be at your pantry lines to clinic visits, kind of across the board there. Community groups can push for shelters that are accessible, family friendly, medically supportive, and located near Alice neighborhoods. And then distributing and advocating for items like CO2 detectors, coolers for medication, or transit vouchers, kind of lowering some of the life safety risks that we encounter. Healthcare continuity during a disaster. So medication and pharmacy disruption. So pharmacy closures, spoiled refrigeration dependent medications, and refill restrictions may put chronic illness management at risk. Many ALIS populations or families rely on single clinic or federally qualified health center. When it closes, they run the risk of losing their only affordable source of healthcare. And then we cannot ignore behavioral service interruptions. So when stress spikes during disaster, but counseling, medications, telehealth access are often disrupted as well, especially for families facing maybe any kind of digital divide. So a couple things that I'd maybe recommend. Organizations can share real-time clinic status or pharmacy status. There are a couple platforms linked at the end of this presentation that I might recommend. And direct families to trusted providers like federally qualified health centers or community mental health service providers. Partner distribute items like coolers, pill organizers, portable chargers to preserve a level of continuity, particularly continuity of care. And then advocate for ALIS populations to be prioritized in healthcare emergency planning, whether it be from mobile medical units to behavioral health outreach. Only a couple more slides left. So if I'm running short on time, Olivia, please just jump in. Post-disaster, key barriers for food and housing. We're looking at food insecurity escalation, so spoiled perishables, lost wages, and transportation limitations intensify hunger. Housing instability and displacement, so lack of reserves for renters insurance makes displacement and unsafe housing common. Slow moving federal state systems really do require a substantial amount of documentation that some households may not be able to provide. So key opportunities, pantries, clinics, and shelters as connection points for food and housing aid. Pair food aid and health and pair food aid with health and safety resources. So vaccinations, safe water, just high level literature to kind of decrease this risk. And then simplify housing aid and ensure ALIS voices are represented in the recovery planning phase. I should only have a few more left. So aid navigation, obviously when a disaster occurs, aid programs really, like I think at the federal and state level, really do require a certain amount of literacy, internet access, and reliable devices, which could serve as a barrier. Lengthy technical forms and documentation could be overwhelming for certain folks. And then trauma, mistrust of government, and limited time kind of block that level of participation. So key opportunities, it could be an opportunity to partner and guide families to through a step process through some of the necessary paperwork, whether it be through FEMA, HUD, and or local aid programs. Obviously, look at libraries, pantries, and schools as access points for digital tools and trained helpers. Local organizations, really kind of serve as that bridge to connect cultural gaps or address cultural gaps and provide feedback to some of the larger aid agencies. And then I think this is my last high level slide. So post-disaster health and behavioral health, some of the key barriers, obviously the recovery of clinics, pharmacies, and providers is slow and costly, particularly for Alice households. Recovery time stigma, cultural and financial barriers discourage behavioral health care, even as stress just kind of persists post-disaster. And then without early support, short-term stress develops into obviously chronic mental health conditions. So organizations, so opportunities, organizations, so normalize behavioral health by embedding it within your trusted community spaces, pair behavioral health with food, housing, and medical recovery services, and then obviously look at your faith-based and cultural groups to offer resilience building practices that reduce stigma. Compiled a list here of just some high-level resources that may be a benefit for you and the populations you serve. Otherwise, thank you very much, and I really appreciate the opportunity to speak.
Thank you so much, Jason. That was great and right on time.
Oh, perfect.
We'll hear more from Jason during our Q&A, and we'll make sure the resources he linked along with a recording of the webinar are shared after the fact. As mentioned previously, we know that the impacts of disasters are felt disproportionately across our state. Often, low-income communities and communities of color shoulder this burden. To mitigate the impacts of the changing climate and the onslaught of extreme weather events, communities across the state have been working to improve the lives of residents through strategic partnerships, community participation, and sustainable growth. To speak more about this type of work, we're excited to introduce Donna Givens Davidson of Eastside Community Network. Donna has over 40 years of leadership experience in areas of youth and family development, community economic development, community partnerships, and community education. Now serving as president and CEO of Eastside Community Network, as well as lecturer at Columbia University, Ms. Givens Davidson has led several organizations. She sits on several boards and steering committees for local and national organizations, and also hosts a weekly podcast, Authentically Detroit. She has earned a Master's of Education Leadership from Wayne State University, a Bachelor of Arts in Political Science from the University of Michigan, and a Certificate of Completion from the Harvard University Summer Leadership Institute. Thank you so much for being here, Donna. I'll turn it over to you.
Okay, thank you for inviting me. I want to start, first of all, by recognizing my friend and partner in this work, Jenna Holmes. I'm saying that because I started working at ECN in 2016, and I met Jenna before then, but it was 2 years after we had a major flood in our community, and Jenna made me aware when I first started to hear about the climate disaster and climate impacts of people who had been flooded, whether it is still having mold in their homes, and also people's appliances not working, whether it's their furnaces or their hot water tanks, and the lack of resources to clean it up. So Jen, I started this job understanding there was a climate disaster in our community, and that you were working from the state level to engage in efforts to clean it up. With that foreknowledge, then in 2016 or 17, I read that there was a study done that if the temperature in Detroit increased by an average of 2 degrees, we would lose more people in Detroit than were lost in Hurricane Katrina. And that became a call to action. The issues were, the challenges were in the fact that people in our community live in substandard housing in a lot of instances, and don't have access to adequate bus transportation. That's true here, but it's true all over the state, and some places it's worse than Detroit. And I recognize that as well, that we're not, ground zero. There's places where there is no public transit, where there are no cooling places. But here, people lack access to transit, and there are no cooling places that are formally located in a lot of communities. And so we started with the theory that there are lots of resources, and how can we work with the resources that exist to create a network of support for people in our communities who face not only climate, but other disasters. So we formed the Resilient Eastside Initiative in 2018 in concept. We began operating in 2019. And then, of course, in 2020, we had a pandemic, which was a whole different type of crisis, but also, built on the power of the concept of a resilience hub network. So to begin, that's just a little framing, and I'll share some of our thoughts. Um, the resilience is something that, I'm sorry, let me go back. I missed a slide. We define sustainability differently than a lot of people. We see sustainability as a management of natural human manufactured resources for the inclusive social well-being of community members now and in future generations. And when I say community members, I don't just mean people who live in Detroit, because we're all connected, one air, one water, one soil. This idea that sustainability means that we're all sharing in the use and management of these resources for our collective social, inclusive social well-being, which is a term that I learned about in these studies and I love. The USDN defines resilience as the ability of people and their communities to anticipate, accommodate, and possibly adapt or thrive amidst changing climate conditions and hazard events. Resilient communities enjoy high quality of life, resilient systems, and economic vitality, conserving resources for present and future generations. Again, sometimes the way we look at community around here is we look at community as sub-communities. But we're really looking at the broader community, that our broader community should enjoy these things, and not just having some smaller enclaves within the broader community actually benefiting. A resilience hub is a community serving facility that coordinates resource distribution and services both before and after a climate disaster or any disaster. When you have a disaster, do you have a place that will coordinate these things? So we look at three things. One, infrastructure. That's a big thing. Sometimes I think we focus on that a little bit too much. We've been focused on solar, and putting solar on a lot of our buildings has been really difficult, but you can also look at generators and other things that are a little bit more affordable. Also providing backup power for medical supplies and devices, and safe space for residents to access resources. And keep in mind that part of this thing, some of the things we're trying to store are food. When we have power outages, or when we, have a climate emergency, a lot of us deal with a food shortage. But there are people who simply don't have enough food already, and who, in a climate crisis, don't are really in trouble. So how do we actually help them store their food? A resilience hub also is led by and people by leaders and staff who are trained to respond to crises. And our vision is that we're working with hyperlocal trusted organizations within a 10-minute walk shed. If you can't get there in 10 minutes walking, and that's not, somebody who is super athletic getting there in 10 minutes walking, then we need to identify other spaces that are more proximal. So these are some things that would qualify as a resilience hub, whether it is the resilient structure. We want to make sure that we have all of these things in place in the structures. And keeping in mind, we're looking at hyperlocal structures. So some of them do or do not function in this way. And that means that we have to work with some of our network partners around this. But energy and water efficient, solar storage and backup power, that's a real struggle for a lot of us. Flood mitigation and water management. Resilient and redundant communication systems. For example, we have a dedicated fiber optic line at ECN, so that our communications are a little bit more reliable than they had been prior to that. We have to look at high indoor air quality. We want people to have safe places to breathe. We'll talk about what some of the emergencies are here that will require that. And then we want our places to be secure. There's so many things that should be happening here. And then we need to also provide transportation. When we have to be able to communicate with people before, during, and after. And then when people are there, when people are using the hub, they should be able to access services. These are mission-driven organizations. It's a national movement. And you can see that this national movement is concentrated in the Northeast, but there are pieces of it all throughout the nation, a few in the Southeast, and fewer as you go west. So the Resilience Hub concept is something that is relatively new, and it's not uniformly understood through the nation, but it's growing. Ideally, a Resilience Hub provides mission-driven community services every single day. Now in Detroit, we have places that when it gets really cold, the city sends out notifications, there's a disaster coming. Go to one of these 8 recreation centers. And that makes sense to some extent. If people who are at risk of a climate emergency use those recreation centers, but a lot of people don't have a relationship, that recreation centers are not distributed evenly throughout the city, and a lot of the programming is not inclusive, and so they're underutilized. A resilience hub ideally is serving people that are the people you're targeting for protection every single day, not just when there's a crisis. And then again, you need to have the infrastructure. During disruptions, you have to be able to provide resources if you're going to be a hub. And we're struggling with this a little bit here because not every location can provide those resources. In the event some of our Resilience Hub partners can't, then they should be able to go to another Resilience Hub and support the other Resilience Hubs in addressing those needs. A Resilience Hub network has to coordinate with public agencies, emergency responders, and partner organizations to be as effective. And that's something that we're working on at ECN now. We have to be able to access health and medical supplies and have be a communications hub. Why do we need resilience hubs? Why do you need resilience hubs, and why are they so, why are they clustered in places in the Rust Belt in a lot of instances? Because there is existing social vulnerability, be it poverty, housing quality, resource gaps, and knowledge gaps. People who live inside of our community, pre-existing health conditions, are already socially vulnerable. We need resilience hubs in places where people cannot meet their own needs. Their housing, in a lot of instances, is in poor condition. Their windows and doors are leaky, and they may have really poor indoor air quality because of legacy pollution. A lot of the people who we serve live in places that have been polluted over centuries, not just decades. Furthermore, they are living in concentrated poverty because of the legacy of racial discrimination and economic discrimination that has forced them to live in a lot of instances concentrated poverty. And so when you have people who are socially vulnerable clustered in places, this means that you need more resources and you need intentionality to address those issues. A lot of times people who are, Black and Hispanic and other ethnic minorities and people also who are poor are climate vulnerable because infrastructure in our communities is less well developed, because infrastructure spending to improve infrastructure is targeted to redevelopment, and so we're ignored. We flood more frequently. And there's been studies that document that when it rains, it really pours into homes that are rental homes, homes that are in poor condition. And so we have some climate vulnerabilities there, but also heat and cold vulnerabilities because we don't have air conditioning in most of our homes. People can't afford air conditioning when they have it. Inequitable energy access is an issue on a number of levels, whether it is people cannot afford energy or energy is more unreliable in low-income communities because our energy grids are outdated and the investment and upgrades happen most slowly in neighborhoods that are with concentrated poverty in places like Detroit. When we talk about inequitable public and private investment, and when you look at the fact that people who are socially vulnerable and climate vulnerable are the least likely in a lot of instances to get greening resources, then you're talking about green gentrification. And a lot of times what greening does is it's used to drive redevelopment, is used to drive wealth creation inside of communities like Detroit, as opposed to being used to address existing problems and to help improve the inclusive social well-being of residents. What constitutes a climate emergency? We'll talk about that in a minute, but when you look at what constitutes a climate emergency, you might realize a lot of people don't understand the challenges they face as a climate emergency. If there's a heat action day, do people experience that as an emergency or as discomfort? Do people understand that when it's really hot outside, you're more likely to be hospitalized, you're more likely to have respiratory illnesses exacerbated in this heat? Or do they just think, well, I'll just work out, I'll just, tough it out? When people do not understand that they're at risk, they don't prepare. The other issue, of course, is air quality. A lot of times we've been getting the wildfire fire concerns in our community, and we understand that we need to do more to prepare, but we didn't always have that understanding. And many people still don't have that understanding. And again, those emergencies lead to sickness and death. And then a resilience hub helps to promote and maintain social cohesion in communities that have been torn apart because of disinvestment and a lot of predatory practices, economic practices that have caused widespread foreclosures, demolitions, and relocation of people. When you have people living in communities where they don't know their neighbors, this can be a problem. And then the final thing about a Resilience Hub network is that we're leveraging existing strengths in our community. We're not coming in from the outside and saying, let's create something new. We're saying, let's build on strengths that already exist. We have limited transportation, again, in our community. We underutilize existing resources, and some of those resources that are underutilized are resources like recreation centers that aren't being used during climate emergencies. But there are many other resources that aren't being utilized effectively because people don't know about them or because of mistrust against systems. And so when you have a Resilience Hub network, you're able to co-locate a lot of resources that are otherwise be underutilized. And sometimes there's access barriers that people, need to overcome. It provides us with an opportunity to coordinate and plan a climate response, a shared climate response, to share messaging, to leverage limited resources, and also to leverage trust of the people who are leading these efforts. We identify 5 extreme weather hazards in our community. Those include flooding, poor air quality, extreme winter, summer weather, extreme winter weather, and power outages. My son just came back from Japan. He was there for the World Championships, and he talked about how hot it was, saying he didn't know Japan was so hot. It's the hottest place I've ever been, and he travels a lot. Um, why was it so hot though? So I looked it up because I was curious. I didn't know that Japan was a super hot climate either, and found out that it's not. But this year has been a severe heat year for Japan, with temperatures reaching as high as 110 degrees at times. Um, in Tokyo, in that whole region, on one day, they lost 120 people at one point. This is not insignificant. When you look at extreme weather, we have already seen hotter summers than we've experienced in the past, but there's no reason why we would not have the kind of extreme heat that he experienced and other athletes experienced when in Japan. So the Resilience Hub Network helps us prepare for that. And then in places like Detroit, where you don't have sufficient trees, you have a lot of pavement and not a lot of vegetative buffering. You also have urban heat island effect, meaning that the city is hotter in certain spots than it is in the general region because of the heat island effect. Extreme winter weather is another issue. And again, a lot of people don't have working furnaces and don't have working hot water tanks. And what do you do when you don't have a working furnace? A lot of times you're using alternative heat like kerosene, and kerosene heating creates a lot of brings a lot of toxins and risk into the house. All right, and then we talked about power outages. In Michigan, in general, yes. But in places like Detroit, yes, as well. I should also point out with power outages, and most of us already know this, that there's inequitable access to solar. And so people don't have access to alternative or supplemental power in a lot of instances. This is just our context in 2025. But there are a couple other things that we want to really emphasize. One of them is that we are working in 2025 to strengthen our previous concepts of what a resilience hub was by incorporating mutual aid and community care into our work. And we do that. We have a free store now where we are collecting donated food, clothing, household items, and we do it on a regular basis, whether it's from individuals or for corporate sources. We also have a community clubhouse, which is very intentionally designed to house unhoused folks. We just received a grant to provide rental assistance for people who are at risk of being displaced for many reasons. And so these types of mutual care, mutual aid activities are already underway, but we are also looking at more of people helping people. There's a number of ideas that we have about how people who have homes that are being underused can sometimes provide shelter in emergency situations to underhoused people that we're working on as well, because we understand some of the risk factors. And then also in this current economic environment, growing food collectively, producing food collectively, and feeding people has become a big part of what we're working on. And we will be opening up a community kitchen inside of our Resilience Hub. So also there's an increased focus on DIY and locally driven planning. And so some examples for the DIY is us teaching people how to create air purifiers using fans, window fans, but also, just teaching people how to grow and, grow their own food. There are people who are working on DIY solar projects in partnership with organizations like Solidarity. The Resilience East Side Initiative is our context. So we're working with trusted community organizations to provide resources and information before, during, and after climate disruptions. And we have two primary partners, the City of Detroit and Elevate, which is a national organization, really focuses on accessing renewable energy, but they have provided resources to support this. And you can see that again, that we really our biggest partnership began in 2020, although we announced our partnership in 2019 and got funding in 2018. In 2020, we came together right at the time of the pandemic. The Kresge Foundation expanded our network efforts, and the first new Resilience Hub was AB Fort Park. We've had Resilience Hub tours. We've helped to provide advice to Wayne County and others on establishing Resilience Hub networks. Our Resilience Hub network now consists of 12 community partners, and actually that number is about 15, one small business and 2 City of Detroit recreation centers. Other partners include Capuchin Soup Kitchen, which is located across the street from us, MAC Development, Bailey Park Neighborhood Development Corporation, which operates a house. What About Us, Inc., which operates a trailer, Transforming Pain into Power, which is a church-based organization, as well as Redeem Detroit, the Georgia Street Community Collective, which is a community farm, Jefferson East, which is another community development corporation, as well as MAC Development, and Brilliant Detroit, which has a network of over 20 homes in the city of Detroit, one of which is located in our footprint. The Resilience Hub is part of the Detroit Climate Strategy. We should point that out. And so we have the AB Fort Park Rec Center, but also there's a new Chandler Park Field House, which is going to serve as a Resilience Hub, part of the Resilience Hub network. And these are some of the people who funded it or partnered with us. We've partnered with, again, Elevate in the City of Detroit, but also Just Air, Wayne County, the Kresge Foundation, the National Weather Service, and the University of Michigan, C's department for the most part. The National Weather Service, we have a cooperative weather station at ECN that is operational. And we use that weather station because we want to be able to more closely understand what's going on with rainfall. When there's rainfall in the city of Detroit, it's tracked at City Airport, but not in the city of Detroit itself, and certainly not on the east side. And what we're trying to evaluate is what happens when there's rainfall in our community, how much of it causes flooding. So we have a watershed management plan we've been conducting in partnership with Wayne State University, which is almost complete. And one of the questions is, due to our infrastructure, aging infrastructure, do we flood more frequently? And can we track what amount of rainwater contributes to flooding in our community? Through Just Air, we are doing air monitoring in a number of ways, whether it is establishing purple monitors. We are also helping residents and students in our community wear wearable monitors so we can see about evaluate indoor air quality and also hyper local air quality on various blocks in schools and in some community institutions around here. The issues of climate and emergency preparation are much greater than what any of us can solve. And so what we try to do is really always focus on changing what we can. And in this current political context, that becomes more and more difficult. But what we want to do is, through our network, provide increased education, exposure, and access, for example, to solar. If we cannot afford solar, because solar for all is not really going to be implemented in our community, at least not in the near future, how can we increase people's education about what the benefits of solar, how to access solar? How can we give people, connections and exposure to solar so they can see it at work? How can we also help people use gas-powered generators until solar so that people have interim plans? Again, the DIY piece, the community gardens and air purifiers are important. Demonstration projects are important. And so there's a couple of demonstration projects I'm really excited about. We have a fellowship program where we're training residents in developing um, um, in developing sustainability projects and understanding sustainability. And then we give out mini grants to support some of those activities. One of the things that we're interested in is a community-driven microgrid, and we have a national partner that's working with us to try to help do that. But there's many other demonstration projects that we and our partners are engaging in. One of the concerns that we have in our community is that we do a lot of air quality monitoring, but we don't do a lot of soil testing. And we know there's a lot of legacy pollution in our community. And so one of the things we want to do is better understand indoor air quality through the lens of soil testing to see what kind of pollutants are impacting air quality in homes through vapor intrusions and other mechanisms. One of the other things that we're doing right now, in light of everything that we're dealing with on a national level, is power building, educating people about systems and how they work, educating people so that people are prepared for a disaster. And they have a go plan when a disaster happens. We don't want people to be informed, go here at the time of disaster, but help them understand how to be prepared. And also just collective learning, where we're learning from each other and providing advocacy support. That is basically what we're doing at ECN to help our community prepare. I think an important message, though, is that we have got to do more to address some of the underlying issues. We've got to do more to stop polluting communities with legacy pollution, for example, and we haven't figured that out yet. We've got to find a way to improve housing conditions and help people live in housing that is safe. We believe that housing is a human right and that cost should not be a reason why we can't invest in housing. And then, we've got to change policies so that the city of Detroit is working more intentionally with organizations like ours, not just the Office of Sustainability, but all of the city departments are working with community organizations to disperse and dispense resources. The final thing I want to say is that in 2021, after we had major flooding, we had just really opened up our Stoudemire Wellness Hub to the community on a conditional basis because we were still sheltering in place and not fully open. But we had to open our doors completely in July of 2020 because 2021 because of extensive flooding that harmed the east side. When we flooded, people came to our community center to fill out applications to the Great Lakes Water Authority, to the Detroit Water and Sewage Department, and to FEMA, so that they could get resources that would help replace what they lost. There are many, many barriers for people in poor communities to access those types of compensatory resources, whether it is they're not homeowners or because the accessory units that they use as housing, like basements, are not considered housing. And so those are the items there are not compensated. Um, People are underinsured and sometimes uninsured because they cannot be insured. And so when you look at those barriers and you look at the level of rejection and the lack of responsibility taken by public officials, we've got to do something to change laws and policies so that our needs are not deprioritized. It's poverty should not be a reason why you cannot access support. So that's what I have.
Donna, thank you so much for that overview. That was great. We're now going to enter the Q&A portion of the webinar. We're also being joined by Jenna Holmes, Executive Director of the Michigan Community Service Commission. So I'll just get right into it. Denise, I have a list of questions in front of me. Here we are. Donna, you spoke about the intersectional nature of this work, and we had a question come in, and Jason and Jenna, please feel free to chime in as well. But a viewer asked about strategies and resources that exist to help individuals with disabilities and their caregivers better prepare for disasters, and how communities can ensure that this information is accessible and widely distributed to
That's
folks.
a great question. Thank you for asking that. First of all of the facilities that are used for disaster preparedness should be, there's disability organizations that can evaluate your space and determine whether or not your facility itself is accessible. Secondly, we need to understand that a lot of people don't have access to transportation when they're disabled. And so if they need to leave home, we need to make sure that we not only provide transportation, but that the transportation can accommodate people with disabilities of various types. Thirdly, the way we communicate should address disabilities. We can't always communicate in writing for people who are sight challenged, for people who have other kind of disabilities. We just need to be trained to work with a wide variety of disabilities, whether they're physical or mental disabilities, and we're not always doing that. So training your staff to be responsive and respectful of people is important. I think it's also important to understand that people who are disabled are not just recipients of care, they are also capable of providing services. And so how do we include them in our planning, service delivery, and treat them as equals? One of our partners has an organization called What About Us, Inc., which has a real focus on including people who are disabled as gifted members of a community and not as people who are lesser. But I think that partnering with disability organizations is always a good step, and people can always give you additional ideas for how to do it. Is like, are your bathrooms equipped? Are your kitchens, as we have our community kitchen, is that equipped? We actually have space in our lower level, but because people are sometimes mobility challenged, and increasingly that's me having difficulty walking down the stairs with my arthritic knee. You want to make sure that people can get to those spaces.
Thank you. Thank you for that. Can you say the organization that you mentioned one more time? What About Us Inc.? Is that
What
what you
about
said?
us, Inc.? Yes.
What About Us Inc.? Great.
Yeah.
Thank you so much. Um, we had someone lift up that Michigan is very rural, and maybe Jenna, you could speak to this. Where can residents go to understand what resources are already available in their communities? Like, where would be the first place that someone should look if they want to be more available during a disaster, but also um, when that time comes, where they should look first?
I'll step in and see if others want to join. Hello, everybody. There's a couple different things that are there in times of disaster. When a disaster happens, look for and use 211, because 211, there's two different things it will do. It'll connect you to the specific resources that you're looking for and help you navigate how to do that. But in addition, you can identify the specific needs. So for those that you're serving, and or if it's yourself needing to report that, we have something that we manage and support in times of disaster called crisis cleanup. And what that does is it allows us to understand the needs of people and connect them to the volunteers and organizations that can best help them. So there's a planning piece that we're looking to do for communities as well. But when a disaster hits, 2-in-1 is definitely the resource you should look to use.
Great. Thank you, Jenna. We had a question just come in that I think any of you could answer. Will we have to be concerned about any of the services being dismantled because of federal cutbacks that have been happening?
Yes, of course, we have to be concerned about services being cut and be prepared for it. I don't think that we should just be reacting. We've known this is coming, and I've been telling people, this is the calm before the storm, right? We're still in a budget year where a lot of the things haven't been cut at the federal or state level, and we can't afford to just complain. We've got to figure out how to equip our communities with what they need. There's two issues though. One of them is that even before these cuts hit, people are already struggling. The services and programs that are being cut never work to fully address the needs. And so rethinking, reimagining what housing looks like for poor people is something we should be doing before we lose all the resources. And one of in the Black community, I don't know about the communities, a lot of people that I know say, well, our ancestors survived worse than this. And I always say they did, true, but they didn't function like we do. Our ancestors were much more collectively oriented. You had rent parties, you had various things in the community where people took in other people's kids, people took in boarders. What will we do as a community to weather the storm? And then to create new systems, ideally in the future, that do a better job of protecting the needs of our most vulnerable populations.
Jenna, did you want to add?
I was just going to add, and Donna said it well, but we are trying to explore what will happen. You've probably been hearing about there are adjustments and changes at the federal level potentially. And I say potentially because we don't know exactly what will happen. But if less resources are at the FEMA at the federal level, that will drive some of those requests to the state. I think it will be interesting to see where that goes. We are one of, I think there's only 2 entities, states across the country that has the state police is the entity that oversees and supports disasters in times of emergencies. Everyone's going to be reevaluating depending upon what funding is available and at what level. So we are watching it, and I think it's a good question, though.
Thank you. Thank you for that insight. And thank you for Donna for talking about kind of the social infrastructure aspect that goes along with emergency preparedness. Unfortunately, when disasters hit, there are sometimes folks who wish to take advantage of the hardship people are facing. Can you talk about common scams people should be aware of when disaster hits? I'll
And
open
common
that up.
scams that people
Yeah.
should be aware of, period. We're gonna scam, we're in the midst of scams. And so we need to educate people on what those scams are. Lots of financial crimes and a lot of exploitative things where people are offering assistance and then, give me this money and I'll give you more money. That actually happened to my grandmother about 20 years ago. So it's gotten there, the thieves have gotten even more sophisticated. And for people who are running organizations, how many times have people tried to engage in financial crimes here by spoofing emails and other things? So free aid, the government is giving out contracts, government is giving out this. That's why collective education is so important. And that's why resilience hubs are so important, because we have a responsibility as trusted leaders to make sure that we're keeping people informed. I did see a question about zip codes, and I don't know if it's a question from somebody who lives in Detroit, but I did want to address that. The name of our organization is Eastside Community Network. And if you live on the east side, then we serve you. We don't have zip code parameters. We just have like a geographical parameter. I think it's important too that all of us work in partnership with people in other places. I would love to see a statewide resilience movement where we really look at, connecting people across the state and finding out what our weaknesses are. A couple weeks ago, I spoke before a Community Action Alliance, annual convening, and community action alliances exist everywhere. So I think it's also important for us to connect and share information about all of those resources.
Couple things, Jason's put in the chat, about the consumer alerts and some things to be aware of. When we say a disasters, it starts with volunteers and ends with volunteers when a disaster happens. There are organizations that are called Volunteer Organizations Active in Disasters, or VOADs. And when they come to help you, they have to have identification, and also as far as that process, and also connecting it through us or through 211 also gives you some reassurance. As Donna referenced, unfortunately, when things happen, and the ice storm, when all those things happen, sometimes people are out and they then will say, here, I can take care of all of this. And then all of a sudden they have a bill, or else there's other things that can happen. So communication is going to be critical. The second thing is, I heard Donna just reference too about the resilience hubs and how could we do that maybe statewide. The commission is actually about ready to do some outreach, and we're looking to ask communities to begin having a conversation around preparedness. And yes, it can be preparedness around disasters, but it can be preparedness around challenges in our lives. And to Donna's point, we should be looking at that statewide and seeing what that means. So as that unfolds, definitely we'll be working with Donna and others who have an interest in that. As part of the reason we put that grant out there as well, to try and generate some interest in how we can start developing a network.
Thank you so much. And we'll make sure that information about the Community Disaster Preparedness Grant is shared with folks after the fact. We are at time, we're actually over. But thank you to Jason and Donna and Jenna for being here today. This is valuable information. And like I said, we'll follow up with the links that were shared and some of the other information along with a recording. Thank you to all who tuned in today for the conversation. And please stay tuned for a follow-up email with resources and to look out for future events from the Poverty Task Force. Thank you.